Hello, this is Siddharth Tambar from Chicago Arthritis and Regenerative Medicine, the clinic where we are 100% focused on musculoskeletal health and wellness, enabling people with the most cutting edge non-surgical treatments available to reduce their pain and maximize their function, allowing them to do the things that they enjoy with the people that they care about. So in today's video, I am talking about the keys of what it takes to make an early diagnosis of rheumatoid arthritis. So this is an important topic for a number of reasons. As a clinical rheumatologist, this is key because this is one of the big conditions that I see and treat, and one that if we can catch people at an early stage, we can make a humongous difference in their life. The good thing is that in the medical community in general, there's been a progressive awareness of catching this condition early in terms of the importance of it. And today's video is meant to really highlight some of the key ways that you can make an early diagnosis. So why is making an early diagnosis important? Well, without a doubt, if you can catch this condition early, you can prevent progression of the condition to more erosive and permanent damage level of disease. That's key because longer term, it means that individual will have less pain and better function. And without a doubt, if you can catch people at an early stage and treat them appropriately early on, you can actually prevent disability and functional decline as well. So not only a huge deal for this one individual patient, but really a huge deal for the overall medical system and even society at large. In addition, if you can reduce chronic systemic inflammation long term, you get a lot of other benefits as well. There's a very clear understanding that in rheumatoid arthritis, that these individuals have much higher rates of cardiovascular disease as well long term. And the thinking is that chronic inflammation left unchecked is what leads to that progressive cardiovascular disease. So there's some limited but early evidence that if you can reduce chronic inflammation, that you can actually reduce the cardiovascular burden in these individuals longer term as well. So there are a number of keys when it comes to diagnosis. There's a lot of subtle things to look for, and these are some highlights that I think are really essential when you're catching somebody at an early stage. So without a doubt, hand and feet symptoms are very key in rheumatoid arthritis patients. Now, the reality is that really these individuals can have inflammatory arthritis in any joint in the body, but prominent hand and feet symptoms are really pathognomonic for this condition. Having symptoms on both sides is another classic tell, although at an early stage, it may not be bilateral, it may just be unilateral. Pain that is classically worse first thing in the morning and better with activity is again another sign of an inflammatory arthritis. And in general, symptoms that have been greater than 6 weeks. It's helpful to catch them even earlier than that, but understand that there are some other disease mimickers that can present for acute inflammatory arthritis, whether that is an actual infected joint or if that's just a reactive arthritis, meaning the body's reaction to either an infection or a medication that can lead to an inflammatory arthritis. Those are typically short-term, while rheumatoid arthritis is really classically long-term. On examination, there's some subtle things that you can see, but the classic findings are swollen, warm, and tender joints. Now, the challenge is that at an early stage, some of those findings may not actually be present. For someone who sees a lot of joint conditions, you can catch some findings of early inflammatory arthritis that are relatively mild and subtle findings that don't become quite as obvious later on. But there are some subtle things on examination that you may be able to catch. So even if an individual doesn't have flagrantly swollen and tender joints, you may notice that they have difficulty making a full grip with their hand. In addition, you may notice that as you squeeze their hands or their feet, that they'll have some tenderness as well. So some very subtle signs that they may have an inflammatory arthritis, something that isn't quite as obvious as what you might see later on. So there are a number of other things that are essential in this diagnosis as well. So labs can be helpful, but the reality is that at an early stage of diagnosis, antibody testing can be negative in 50% of patients. So that includes the rheumatoid factor and the CCP antibody. Longer term, 25% of these individuals can be antibody negative. That's important because while the antibody testing are helpful to help confirm diagnosis, that's not actually how you make a diagnosis of inflammatory arthritis. Inflammatory arthritis is really diagnosed based on, do you see evidence of inflammation in the joints on exam or on imaging? And I'll get to that in a moment. So the classic inflammatory parameters, a SED rate or a CRP, they may or may not correlate with disease activity. In some people they do, in some people they don't. Again, it's a disease marker that can be helpful, but should not fully rule out someone from having an inflammatory arthritis if you have other symptoms and signs objectively on exam that indicate a more likely inflammatory arthritis. Regarding imaging, the imaging study that I think is most useful for rheumatoid arthritis, but inflammatory arthritis in general, is diagnostic musculoskeletal ultrasound. For those of us who are dedicated to musculoskeletal health and wellness, in terms of caring for those conditions, musculoskeletal ultrasound is essentially our stethoscope. Without it, you really only get a limited picture. Examination is helpful, but ultrasound can pick up a lot of very subtle findings of inflammatory arthritis, including very subtle effusions in the joints that you cannot necessarily pick up on examination at an early stage. In addition, ultrasound can pick up what's called power Doppler uptake, which is a sign of more aggressive inflammation than just having fluid in the joint. So a very key diagnostic factor, but in addition, a very key prognostic factor, because if you have some of those findings, it can indicate a risk for more progressive disease. Some of the other imaging studies, such as X-rays, not as helpful at an early stage. X-rays in someone who's had long-standing disease can eventually show erosions, but really at an early stage, not as helpful. MRI is the most sensitive study when it comes for looking for subtle inflammatory arthritis. But the reality is, if you weigh the cost associated with MRI versus ultrasound versus the slight increase in sensitivity for picking up inflammatory arthritis, ultrasound still works out as being the better imaging modality. What are the next steps that you should take if a diagnosis of rheumatoid arthritis is suspected or inflammatory arthritis is detected? Without a doubt, a rapid referral to rheumatology is necessary. And again, that's because if you can get disease-modifying treatment started at an early stage, you can prevent progression of this condition. That's incredibly key. Now, the reality is that that referral should be within 2 weeks, I would say. If it's taking more than a month, think about having a conversation with your local rheumatologist to encourage them to see that individual a little bit earlier. In terms of medications, the classic meds that are used, anti-inflammatory medications, NSAIDs, ibuprofen, Advil, Aleve, Celebrex. Realistically, these should be minimized long-term. While these have been classically used in abundance and overused in our inflammatory arthritis patients, they really should be minimized. Steroids, while they have a ton of long-term side effects, short-term usage to help control inflammation as it's decided what disease-modifying treatment to use is okay and is appropriate to give an individual quick-acting relief as well as help them to function better. But without a doubt, getting started on a disease-modifying treatment is the most important first step when it comes to treating rheumatoid arthritis. Methotrexate is the classic medication at this stage. There can sometimes be an argument made for people that have mild inflammatory arthritis to utilize a milder medication like Plaquenil, but methotrexate is still first line, and then relatively quickly escalating to a biologic medication, which are stronger and generally do a better job if someone's failing methotrexate. Long term, there are other things that patients can do as well, including focusing on an anti-inflammatory diet, which includes relatively low carbohydrate diet, low refined sugars, avoiding refined sugars, minimizing red meat, and being a bit more plant-based. Supplements such as omega-3, high dosage, as well as turmeric and curcumin can help with inflammatory arthritis as well as pain. And then certainly exercise is tolerated to maintain muscle strength, and mobility is key in inflammatory arthritis as well. That's the basics. That's how you make a quick diagnosis in terms of catching someone who may have an early rheumatoid arthritis diagnosis, some subtle examination findings, classic symptoms. Labs may or may not be absolutely correct and correlating, but a rapid referral to then help make a more firm diagnosis, utilizing more modern imaging technologies, including diagnostic musculoskeletal ultrasound, and getting that individual plugged in and start on treatment early is key for improving this condition, improving their life, and making a big difference. If you'd like to learn more or have questions, check out furthermore at my website at chicagoarthritis.com. I have quite a bit of educational material on that, either through blog, webinars, videos. There's a podcast now. We're also on all the different major social media sites. If you want to check us out on the social channels, you can look us up on Facebook, Twitter, LinkedIn, Instagram, all the usual ones at this time. Any questions, you can email me at admin@chicagoarthritis.com or call me at the number listed, 773-348-7171. That can be a further assistance. Please let me know at any time. And thank you for your time. Have a good day and live well. Thank you.